Thank you. Namaskar. It's great to be with Indian Community School once again. And I got a special attachment with the Indian Community School. Thank you very much to Dr. Binumon, especially who was instrumental in innovating everything right from his taking charge of community school. There were many firsts in community school. Am I audible? Am I audible to everybody?
Yes, sir.
Okay, thank you. Thank you very much. So I would like to thank all board members and especially Dr. Pratap and Mr. O. Yogesh for the wonderful introduction. And especially Pratap had conveyed a lot of message which is apt for the current scenario. Now I'll be taking you across with a few slides about what you got to know about COVID. And the whole thing will be driven by your queries, your doubts, so that I can weave around your doubts and it will be more beneficial for you than my talking over 1 hour over the slides. So I'll be having only very little slides and what is necessary. So with that few words, I'll just get into my job about this and I'll put my slides online now. So I'll be going small and you'll find the slides online. Yeah, COVID, it's nothing new. My slides are visible, I hope so. I suppose my slides are visible. Okay, fine. So COVID, everybody knows about COVID. Probably each one of you should be knowing more than what I really know. With the media on your fingertips, social media bombarding you with everything about COVID and forgetting everything else in this world. So the world is now COVID centric. It's revolving around COVID only, as if that is the only thing which humankind or mankind should bother about, sadly. So COVID, are we going to conquer it or coexist? The fact is, conquer? Well, till today, we don't have anything to conquer COVID. Well, it's a matter of time, probably we'll be having many armamentarians to bombard COVID and conquer it. So as of now, we don't have anything to conquer it. So what is next? We got to coexist with it. We got to know to live with COVID. That's the best. Now, if you can't conquer, live with it. And how best can we live with it? And that's what we got to know. Each one of us got to know about it and what the facts we got to take into our real life, so that the fear, each one of us is fearing COVID as if that COVID is going to wipe out mankind from this earth, which is not true. Human fear is so much so that they take the worst always into their head. In 1919, we had the worst pandemic ever, which wiped off millions and millions of people. Still, mankind went on. So my job is to see through what COVID exactly is and how much we really need to fear about it. Our life should go on, not fearing COVID. So let us all learn to coexist with COVID. So let us learn to live safely with COVID. And how can we do that? Before that, I'll give an insight about a small epidemiology. I'm not going to the details of it. Each one of us fear about death due to COVID. And that's the first thing which hits our head. If I get COVID, am I going to die? So let us take a few statistics. Out of 100 people who have COVID positive, 80 of them will not even know that they have COVID until unless they are really tested. So they are virtually an asymptomatic people. 80 people will just not know. 15 of them will have severe symptoms, but somehow they will escape, undergo all those other, whatever tests, whatever medications, whatever support they get, they survive. And it's only that 5 people of the 100 who go into a critical state and probably we may not be able to save them. So out of 100 people who have COVID, 5 may not live. So it means 95 of them are free of it despite having COVID. So remember that the hype created about COVID is so much that we fear that everybody is going to die of COVID. And that is not the truth. And it is less than 5%. So that's why I put this epidemiology, what says that 80% absolutely will not know whether they really do have COVID until unless they are tested for it. Now, what are the symptoms? When I go through all the symptomatology of what COVID is going to cause, probably all those people who are online in this will feel that everybody has COVID. That is medicine. Medicine has got a lot of logic than symptomatology or you have the tests there. So fever, you have fever as a symptom for each and every, there's so many diseases you have fever. So I'm just going to tell you about the symptoms, not to fear you or not to have suspicion that if you have fever, you have COVID. Okay, so whenever you listen to my talk, please don't be COVID centric that everything is COVID. Absolutely not. So the commonest symptoms which each and every one of us know is fever, and 98%. That means almost everyone would have fever. Dry cough. That's something which is important. A cough which has got sputum or which has got an expectoration is very, very unlikely to be COVID, because you know that most of us have respiratory problem, asthmatic problem, COPD problems, allergic problems, all of them have cough, but usually they are productive. You have a running nose, you may cough out some sputum. So whenever there is a dry cough, 80% of them who has COVID will have a dry cough. Fatigue, it's almost any illness will cause fatigue. So you needn't worry much about it. It's a part and parcel of it. Anorexia, your appetite brings, naturally your appetite will come down when you have a fever. Shortness of breath, well, that's important. A fever with dry cough and you just can't breathe. That is why it's important. Normally, when you have just a fever or a cough, your breathing would be all right. Whenever you feel that there is a shortness of breath, you've definitely got to seek attention and find out what is wrong with you. Now, if there is a sputum protection, usually it is not COVID, and very few, 30% of them do really have sputum protection. That is expectoration. You cough out sputum. Myalgia, that's what body ache. If you have a body ache, most of the viral infections do have body ache, and COVID also does cause it. And some of the less common ones, of which probably you should be knowing, is loss of smell, what is called as anosmia, that you can't appreciate smell well, or loss of taste. In loss of smell and loss of taste is something partially unique to COVID, not all illnesses. That doesn't mean that if you have loss of taste or loss of smell, it is COVID. No, until unless you are proven by the tests, you cannot say that you have, but it can lead to a suspicion that you may have COVID. So no need of running around saying that I just can't smell things or my smell is weakened, I can't smell it properly, it means it is COVID. So what I'm saying in short is, don't literally take everything to heart that these symptoms means it is COVID. No, there are all so many other area of diseases which has got common symptoms. Now, I just put an insight about, because COVID is a rather relation of a common flu. All of us would have a flu during the seasonal changes. Whenever the season changes, invariably you will be having a common cold or a flu. And you just forget about it. You don't bother about it. You have a body ache, you have a slight fever, you have a running nose, and that is it. But what is unique in COVID is, usually it is dry. That means you will not have a running nose. If you look into the symptomatologies, the symptoms are 1 to 14 days in duration. Common cold or a flu is of a very short duration, 1 to 4 days or 1 to 3 days. Symptoms, it's gradual. Fever is common for everything. Cough is there, but usually it is dry. But in the flu, it is usually productive. Fatigue is common for everything. Running nose is more common for a common flu. You may sometimes have an upset tummy. You have a diarrhea, which is common for any viral infection. Body ache is a common factor for everything. Sore throat is more common in COVID, until unless you have a tonsillitis or an upper respiratory infection of any other cause. It's more common in COVID. Considering that the current era, it starts up with sore throat, dry cough, body ache, fever. Headache is common. You will have a frontal headache, a throbbing sort of headache, loss of appetite, shortness of breath. That is something which is very important. Any fever with symptoms of cough, body ache, fatigue, and shortness of breath. That is to be taken somewhat seriously and where you need to seek attention. And the doctor definitely would go in for a COVID testing, and that will depend on a COVID, whether you're positive or negative, the further treatment will depend on that. So whenever there is a serious respiratory issue, that is where you need to run to the doctor. Not that since you have a fever or a body ache, now I have COVID, now I have to run to the doctor. There's nothing much is to be offered, even if you have COVID with just a fever. So I just want to tell you that don't confuse it with a common cold or a flu, a seasonal flu. It's almost identical. So with the current changing of the weather, when it goes from summer, you get into a winter, definitely most of us would be having a common cold or a flu coming up. So don't get worried about that small symptoms which overlap. Now, when to suspect a case. So these are few cases which I would tell you when you really need to suspect that it could be COVID. Any symptomatic individual who had an international travel in the last 14 days. The symptomatic means what all symptoms is related to the respiratory fever. You have a cough, you have body ache, and all the symptomatology, and you had an international travel, whether you have traveled outside Kuwait or you're coming from Kuwait to India, you have to be tested for COVID. That is 14 days is the time. Now, any symptomatic contacts of a confirmed case. Now, for example, if in my house, if I am COVID positive, anybody else who has got symptoms in my house definitely has to be tested. Any symptomatic healthcare worker. Healthcare worker means right from a worker who is doing cleaning job in a hospital to the doctor who is treating. All come under healthcare workers. Anybody who has got symptoms related to COVID has to be screened. That these people will be a suspect case. All hospitalized patients with SARI. SARI means sudden acute respiratory illness. That means what I told you about, whenever you have a fever and you have shortness of breath, that is where you call it as a SARI. You need to be hospitalized and you will be tested for COVID. And that is why we suspect that this case could be COVID. Asymptomatic, direct, and high risk contacts of confirmed cases. Now, being a doctor, I happen to see a COVID positive case. I am asymptomatic. Despite being asymptomatic, I need to be screened. So any asymptomatic who had a direct contact with a COVID positive case need to be screened. And we are just telling about screening, not hospitalization. So everybody fears death. And the only truth in this world is everybody is going to die. Nobody can deny that. Now, how are we going to die? That's a fact of life. Nobody knows which way we are going to die. The fear here is COVID. Is it going to take us off this world? No. I'm just going to put you certain figures which tells us that the overall death due to COVID, considering that if 100 people have COVID, maybe 3 to 5%, and average is 3. Overall, I talk about the total community, overall is 3%. Out of 100 people, only 3 will not live. 97 of them are okay, they live. But who are at the higher risk? If you look into the bar, people who are above 80, what you call the senior citizens, they have a 14% chance that they will not live if they have COVID. So if you take 100 people who are 80 years old, 14 of them will not make it, 86 will do. They will just make it, come back. If you look into the people who have cardiac diseases, like people who have a previous heart attack, 10% of them will not make it. That means 90% of them will be cured and 10% will not make it. And now if you take diabetes, which is more common, 7 of them will not make it, and 93 will be all right. So it tells us in short that if you have comorbidities, the chances are slightly more compared to the other people who don't have comorbidities. And that's why the dictum is elderly people, please don't go out. People who have cardiovascular heart ailments, who have diabetes, who have other comorbidities, kidney diseases, please keep away and be safe. So this statistic is just to tell you that there's nothing to worry, nothing to be so alarming that everybody having COVID will go off. No, definitely not. There's a big chunk who will just come back, make a recovery. So I will give you a glance of how people die in this world. I'm sure most of you would not be knowing it because you're all COVID centric and you all fear COVID is going to wipe out this humanity. You'll be surprised when I put these statistics, and these are valid statistics. And why I put this is to tell you about, just to compare you about COVID. Now, every day, I'm talking about one day, every day, 1,25,000 people leave this world. They die. 1,25,000 die every day in this world. And it's just the double how many are born every day. We'll leave that aside. We are talking about how many people die. And of which 35,000 people die because of a cardiac disease or a stroke. They have a heart attack, they have a stroke, and they don't make it. And 35,000 people leave this world every day. Just look at this. I'm sure none of us would be knowing this. 24,000 people every day lose their life just because they don't have a square meal. They don't have a square meal, so they die out of starvation. I'm sure none of the people who are online here would have known this fact. Cancer, it takes up 18,000 people every day. 18,000 people leave or they die every day out of cancer. Smoking, 11,000 people die every day out of smoking. Alcohol, 6,000 die every day. Now, look into COVID. In the current situation, what I'm talking about the statistics, which is about revolving around these 2 days, it's around 5,000 people die every day out of COVID in this whole world. I'm not talking about a particular country. In this whole world, it is around 5,000 approximately. Now, if you look into HIV AIDS, it's more than 3 decades we are fighting for it. 4,000 people die out of HIV and AIDS every day. Road accidents, 3,000 people die on the road out of negligence. Suicides, 2,500 every day. These are all daily statistics. And the worst of all is 2,000 people die every day because they don't get safe drinking water. Pathetic. Now, if you look into the red, all those it is in red are preventable. If you look into the statistics which I've shown you, all those that are in red are preventable. That means 50,000 deaths per day are preventable. And remember, COVID, you cannot say it is preventable. We could see that we are safer. We cannot say 100% that we can prevent COVID. Definitely not. Starvation we can. 100% we can prevent. Safe drinking water, alcohol, smoking, accidents, suicides. So just imagine where COVID stands. I put this statistics simply to tell you that why are you fearing that only 4,000 people, well, if I say only, it doesn't sound good, but that is nature. Nature is dynamic. People go and people new are born. So in a dynamic situation, there will be many people who will be wiped out, and of which only 4,000 is dying out of COVID. Sorry, 5,000 is dying out of COVID every day. So the message, what I'm telling you is, you should fear more out of dying out of starvation, dying out of smoking, dying out of alcohol, or driving rashly, or taking your life, suicides, or if you don't have proper water. Well, we are all well off. Fortunately, we have got good water, we have got good meal. So we are out of the starvation and out of the drinking water. But think about road accidents, smoking, alcohol. So it's my humble request, each one of us, just remember these statistics, then you will know, why should I fear about COVID? when so many people are dying out of other things. And I also stand a risk for all these things. So let us move further about COVID. So take it out of your head that COVID is going to kill me. We are going to live with COVID. So that is what I am telling you. We will learn to live with COVID now. We will conquer COVID later. So what next? Prevention is better than cure, which each and every student, each and every teacher should be talking to the students every now and then. Prevention is better than cure, prevention. But that has to be slightly modified for COVID. It is the only cure. Prevention is the only cure for COVID. So remember that prevention is better than cure doesn't apply for COVID. Prevention is the only cure for COVID. So how do we prevent it? What are the ways we can prevent? I'll give you a few tips on COVID.
Did you listen to what I said?
How prevention should we go ahead with prevention is first about protecting ourselves. In a plane, whenever you get in, you have that air hostess are talking about when the oxygen drops. First, you have to use the mask for yourself. It stands for COVID also. First, look after yourself, then look after the others and societies. So that is very important. So how will you protect yourself? Very simple. Most of us know. I'll just once again elaborate it. First and foremost, wear a mask in public. Absolutely, there is no excuse for that. You have to have a mask because it prevents in many ways. Even if there is a simple mask which doesn't have what you call all those certifications, it still helps. Not all, and I'll tell you the fact, it's not that everybody should be wearing N95. Remember that is not the rule. You just have to have a simple mask. Avoid contact to frequently touched objects. Now, I'll take school as a surrounding. That will be very apt because I have an audience of school children. School, you have the doors, you have the knobs, you have the your desk, tables, everything. All your paraphernalia are touched by many people. So what is to be done at this present scenario is that avoid that to the minimum. Sharing books, holding on frequent, like for example, railings, lifts. See that you don't frequent, and if you happen to touch it, I'll tell you what next to do it. So avoid those contacts as far as possible. Physical distancing, or what is called as a social distance. Social distancing literally means physical distancing. At least 6 feet or an average of 2 meters. And this is calculated on the basis of how far a droplet can travel unprotected. So that's it. It doesn't mean that beyond 6 feet it is absolutely zero. No, it can travel a bit further depending on the force of your cough or your sneeze. But average 6 feet is well and good. So that is what is necessary for the current scenario. So 2 meters or 6 feet roughly. Hand washing with soap and water. That's a wonderful thing to do and which has been harped on for years and years and together. A simple soap which doesn't need to be a branded one or which contains Dettol or Savlon, nothing of that. A simple soap. The logic behind it is our virus has got a lipid covering. If you have your hands smeared with oil, what do? Just wash it with any soap, it gets out. So when you wash with any soap, this breaks the cell wall and that your virus is dead. So a simple soap can kill your virus. And do this hand wash as frequently as possible whenever you're exposed, whenever you touch frequently certain objects, whenever you have reach your home, first thing, wash your hands. Avoid touching your face, picking your nose, rubbing your eyes. An average person touches his face 20 to 30 times in 1 hour. That's pretty big. You unknowingly do it. You don't know that you're touching your eyes, rubbing your nose, whatever it is, putting hands in your mouth. So average person does it 20 to 30 times in 1 hour. So imagine in a 12-hour period when we are really in a wakeful period, that should be it's a big, around about 100 to 200 times you keep touching your face. So consciously see that you don't do it, especially in nose speaking. Remember, COVID virus is a respiratory virus. So its access is through the respiratory system. And that's the worst thing you can do. And those nose speakers, consciously keep your hands crossed always so that you don't put your hand into your nose. Now, further on, what all? Washing your dress after single outdoor use. Now, I'll take a student as an example. He comes to school in uniform, goes back from school, put your uniform into the washing machine. Simple, you don't need to put detergents and litters over it. Simple detergent which you have been using before, clean it. So that means you don't take your contacts, though it is very, very low. I don't have a phobia that I'm telling you that if you go to school or you go to some other place, you have to immediately wash your clothes. No, it is reducing your risk, and make it a practice. The moment you come, put your dress into the washing machine, go on to your whatever dress you are at home. So washing your dress after single outdoor use. Using separate footwear for outdoor use. Naturally, most of us in Kuwait are doing that. We don't wear what we are wearing outside. So I don't think so I need to stress on this, because you always have to keep your footwear outside, wear a new set and get inside. And this is because footwear is where you go, it takes you everywhere and picks up everything. And remember that by accident, if you happen to wear the footwear inside also, it's not going to cause much trouble, because the chances of termites getting inside is so low in a footwear also. But we are seeing that we plug that also. These are all preventable things. And these are no Herculean tasks. You have just got to remove your shoes outside, wear a new one. So simple. People of the age below 10 and above 65 years preferably stay at home. This has been advised because they are the vulnerable group. Regarding children, I'll tell you that it doesn't mean that anybody who is below 10 are highly susceptible. No, but you can't control them. That's why they are preferred to be at home. Of course, going to school is a different story. As of now, the schools have not opened. So elderly people, stay back at home. Don't try to go out. Any age with multiple comorbidities. So any person, be it 40 years, 50 years, 60 years, who has got multiple comorbidities. Multiple comorbidities means you have some other disease for which you have been taking medicines. The commonest is heart ailment. You've got a diabetes. You've got a kidney disease. These are the common things. And especially people with COPDs, respiratory illnesses, who commonly have asthma and all, see that they stay back at home. So whoever has comorbidities, preferably stay back. And good hydration. That is very important. The more dry you are, the more you are parched up, they crack. They are the easiest place where this virus can enter. The better you are hydrated, the better everything would be for you. As if, I mean, I needn't tell you much about it, because you know that whenever you are dry, you have that throat which is parching you, you will invariably take water. And in summers, it is for sure. So see that you are well hydrated, and well hydration means that any fluid per day should be more than 1 to 1.5 liters. If more than that, well and good in summers. In Kuwait, we always say 2 liters, 2 liters or more. Any liquid, I'll tell you, no fancy liquids. It's not that you have to take something cold, something mixed up with this, soda mixed up, warm water, turmeric, whatnot. There are so many things out in the market and so many wrong notions, which I'll come to you later. So good hydration is very important. So those are the things which you do to your as an individual for the protection. So self-protection is the first thing. Then you'll think about the society. How do we protect the society? Well, mask, there is no excuse. Anybody getting out has to wear a mask. There is, and in fact, in my place, Kerala, you are penalized. You have to pay a fine. If you don't wear a mask, you have to pay a fine. Physical distancing, I already mentioned, it stands true outside. If you have any respiratory symptoms, stay back. That's what I told you earlier. Anybody who is having an asthmatic problem, who has got a chronic obstructive pulmonary disease, stay back at home. You're all a vulnerable population. Travel only if direly necessary. If you really need to go for your groceries, if you want to go to school or do some jobs which is direly necessary, then only need to go out. Absolutely, there is no role for social visits, no physical expression of affections other than namaste. Beyond namaste, nothing else. And that's the wonderful way to express our affection. Especially in Kuwait, I got to tell you that embracing, hugging, kissing and all is a common way of expressing affection. This has to be stopped. So namaste, the Indian traditional namaste, is the best way to express your affection. Social visits, already I have expressed that. You should see that it is bare minimum, especially visiting people who are sick. No, you don't need to. You got to inquire whether they are fine. No, you got to have all your means. You got a mobile phone, you got video conferencing. So many other modalities where you can communicate and keep in touch. There is a social contact maintained with all the distancing. With the current, all the gadgets which we have, we are never distanced off. And in fact, I'm sitting here in Kerala and talking to you 4,000 kilometers away. Usage of glove while handling packages. Well, I want to tell you, there should not be a phobia that you go to a supermarket, wear a glove and then only touch things. No, definitely not. It is suggested for people who are always handling packages, especially courier people. If you go to the hospitals, you find them, they will be handling many things they'll be wearing. It's not for a common person that you got to always wear a glove. Good respiratory hygiene, very important. As a school, as a teachers, they have to instruct the students on how to cough and how to sneeze in public. These are things which you can't prevent. Nobody can stop a sneezing if you really have it. So what do? You already have a mask, still cover. You can cover this. This also prevents, but the best of it is, excuse me, best of it is you go to a place where there are not many people or there are no one. Then sneeze or cough, come back. Because at the current situation, when you cough in public, the moment all eyes will be turned on you thinking that you have COVID. And you will be the one who will be penalized for that. So the people have that view that moment you cough in public or sneeze in public, you see a COVID. So everybody looks into the other person as a potential threat of infection. This is not to be done. Never to be done. Never be suspicious of another person, but you keep all the social norms, distancing and the mask. But never view a person as a potential threat to you that this person is going to transmit COVID to me. So that will affect the relationship. And that leads to all other problems subsequently, which is happening. You hear in social media that this has happened, that has happened. So consider the other person to whom you're speaking or facing that he doesn't have COVID. But if he's not wearing a mask, it is your duty to tell, please wear your mask, as humble as possible. Now, let's go on further. Myths regarding COVID. It's huge. Probably I can speak for an hour or two or together for clearing your myths. And I'm sure that you will have enough doubts, and I would love to answer that also. Please don't keep it to yourself. We would answer that. Each and everything would be answered. If you have any such fear, I would definitely love to clear it. So what are the myths? I have put everything into a bottle. I hope most of you know what a bottle is. Just look into this. Just have a look into this. This is what is the myth of COVID. So many things. If you read it, it will take a lot of time. So I just put it into a bottle that there are so many things. Each and everything will take a lot of time to tell you that this is not true, this is not true. And the fact is, none of this is true. Which you get it on social media, and that is the worst thing in COVID period. They are not transferring true information. They are transferring so many informations, or rather I'll tell you 80% of the information are not true in social media. As far as India is concerned, as far as the place from where I am, the government looks into each and every forwarded message regarding COVID to check out its authenticity. And if it is wrong, that person is penalized. It will come under the Indian Penal Code and you're liable to be arrested. So that is the amount the government is taking to check all this nonsense. So definitely, please feel free to ask whatever doubts you have regarding this, and I will answer to you why it is not so. Now, most of you should be running around to come back to India, and we would always welcome you here, not fearing that, of course, you have COVID, we don't want you here, you're an unwelcome guest in India. No, we are proud to receive you as an Indian. We are proud to receive you back home. So don't have the fear, but there are certain norms which you have to follow. And this is not only for your health, it is also for the community. And that is it. 14 days of quarantine is a must if you're coming to India. And 14 days of quarantine will be in a place depending on your choices. It will be a government quarantine, or if you want, you can have a paid quarantine. In Kerala, people who are from Kerala, the government has said only 7 days. It's only in Kerala, I'm telling you, 7 days of quarantine, and 7 days you can have a home quarantine. Though the Indian government has said that it is 14 days of quarantine. And that is, you see that you strictly maintain it. Please don't break it. It is for the sake of society. Everybody has a feeling that I don't have COVID, then why should I bother? You can be an asymptomatic carrier. You can spread it to the community, and that's the worst thing you can do. So that is why the strict norm is there. You're all welcome back home, and we will treat you so well that you will not have any problems. 14 days quarantine can be a home, institutional, hospital, depending on the state and the government policies. I told you about Kerala government policies. It will be a 7-day institutional quarantine, and the rest 7 days you have to be in your home if you are asymptomatic or if you are turned out to be COVID negative. If you have symptoms and not or unable to test COVID, when you're coming to India, I'm talking about when you're coming from Kuwait to India and you feel that you have a respiratory problem and strongly feel probably I may have COVID, and the government authorities there did not do a test or refused to do a test, don't get worried. You wear a N95 mask. You would be screened when you reach India. And if you have fever, definitely your COVID testing would be done. In the aircraft, there are certain norms of social distancing right from the entry while boarding as well as in disembarking. Now, you know that there is how the airlines follow a social distancing policy regarding the seating arrangements that they will tell you when you enter the plane. But as Indians, we are cultured to get up the moment the plane stops, which is a sad thing, however educated you are, however uneducated you are. And all these years when I was flying from Kuwait back, I had always seen that the moment the plane lands, and you will find everybody standing up, as if that everybody is going to jump out of the plane. It's not possible. You can get out only one by one. And that's the fact, and that's the truth which everybody knows. Still, all the 180 passengers will start standing up, cramming up. This is the worst thing you can do. Please be dignified to sit in your place. Get up one by one with that social distancing. And this is the best thing you can do in a plane. You remember that it's a very small place. The plane is a very small place. And it's the best place where you can say COVID can spread. And from your side, what can you do? Keep that social distancing and the mask. This will save you. And don't have the phobia that the aircraft is having an air conditioning system which can circulate this. Well, technically speaking, yes. But there are aircraft, most of it have a HEPA filter, and most of them are partitioned. Unlike a general single air conditioner, they are all partitioned. And most of them have HEPA filters. I don't know how, which all have it. So don't have that fear that the air conditioner is going to cause COVID to me, spread COVID to me. Sit calm, get yourself well hydrated when you're in a flight. That's very important, because you get dry when you're in a flight because of the AC. This is what you can do, and never remove your mask. And whenever you go to the toilet, see that you touch objects to the bare minimum and wash your hands. So you're always welcome back home, but humbly, please follow the instructions. It is for the good of the society and also for our own. So coughing, sneezing, despite a mask, I already told you what additional measures you take. You feel like sneezing in a plane, go to the toilet, sneeze, come back. If at all it's just inevitable, definitely the whole plane will look it back, whole people in the plane look back on you. So see that you cover your face with additional precautions. If you have another towel or you put your arms onto it, elbow, the best thing is go to the toilet, sneeze, come back. So all these social norms has to be strictly followed, especially when the plane stops, because that's the common problem which I always found in a plane. Regarding the laboratory tests for COVID, I will not be elaborating on it, which because it's beyond your reach, because not everybody can go and say, I want a COVID test to be done. RT-PCR is the gold standard for testing. It's where they check the virus directly. It's a reverse transcription polymerase chain reaction, and that's the best test as of now. And unfortunately, it takes time. It's not a rapid test. The shortest duration you can get an RT-PCR done is 3 to 5 hours. You cannot do it before that because it requires a lot of other things to be done. Now, there are other serological testings. You have in the antigen testing, you have the antibody testings. Well, quite a few are all approved, but still the gold standard is RT-PCR. Of course, viral cultures are there, that takes time. So as of now, we will stand with RT-PCR. When you have the doubts, I'll clear it whenever you ask me questions about that. The timeline of a COVID infection is, if on day 0, if you get infected, average it is on the 5th day, the first symptoms may start. On the 7th day, you have one of your antibodies coming up, that is the IgM. By the 14th day, you have another antibody which is protective, which comes up. And by 21 days, the IgM disappears. By 28 days, you have everything. You have the COVID out of your system. This is the average period. So up to day 5, you are on the asymptomatic phase. Up to day 7, you are in the window period where your RT-PCR testing may be positive, may not be positive. That's why they are repeating it on day 14 also. On day 14 to 21, there's a decline phase, but you are still infective. Up to day 28, you can be infective. So that is why the government are still saying that even after 14 days quarantine, keep yourself for an extra 14 days at home. That will be the best. Now, regarding a word about hand hygiene, because everybody should be knowing it, because every nook and corner it's been practiced. You have all those boards, signs, and everything about hand hygiene. One thing which is very important is you have to have, if you're washing with soap, 20 seconds is the minimum possible. 20 to 40 seconds is a must. Now, the fashion of using hand rubs, everybody is carrying it. I presume everybody going out should be carrying it in a pocket. But remember that it should be having at least 70% alcohol, and that is the main ingredient what is necessary. All the rest is aside. Whether you have a moisturizer into it, whether you have a perfume into it, it doesn't matter at all. It should have at least 70% of alcohol into it. So that you can do, wash it up, and I'll show you all how you do a hand rub and a hand washing with soap. Remember that it is 20 to 40 seconds when you're using soap. Now, whenever you go to the toilet, bathrooms, whenever you go before food, after food, when you're making your food, when you touch garbage, this is where you need to perform all these hand rubs and hand washes. Foot operated sanitizers now are fashion, and definitely they are really good because nobody touches it. It's your foot which works it. So the chances of a transmission through fomite is less in that. And now most of the common public places have a foot operated sanitizers. Now this is the WHO standard on how you do a hand wash. It's very simple. You take the soap into your hand, liquid soap, rub it, you're rubbing it, you can see that. The next thing is you can see the video here. This is how you do, putting your fingers between the other hand's fingers. Do it this way, go the other way around. I suppose you can see it well. Then this is where you rub it, here. Then the next step is here. You go across. Then rotatory movement of your both thumbs. Okay. then rotatory movement on your palm here. And finally, wash it off. And these are the 7 steps of an adequate hand wash. And this usually definitely will take minimum 20 seconds. And why you want to do all these processes, because the soap has to spread everywhere across your hand. And if you do only these 7 steps, then only it will be adequately spread all around your hand. And hand wash technique has to be practiced and monitored, especially teachers in an institution should always demonstrate it and frequently see that the students are doing it in that way. Because you know that washing soap, you just do it that and that's the end of it. It's not enough, definitely not enough. So this is what the teachers of an institution can do. Help your pupils, students to know what the art of hand wash is. And this is the WHO standard on how you do a hand wash. Clinical management and treatment of COVID is beyond your scope because I needn't talk much about it. You have got so many things every day. It's bombarded that you have found a cure for COVID. The truth is definitely no. There are so many treatments tried out for COVID. Definitely personal protection equipments. And since most of you are not in this field of being a healthcare worker, you didn't bother about it, that you need to wear those PPE protection things when you're working out. For a doctor like me, definitely we need a PPE whenever we go to a suspected patient. Now, you have heard about ritonavir, lopinavir, tocilizumab, convalescent plasma, ivermectin, oseltamivir. HCQ is a big fancy here, azithromycin. Well, as of now, we are just about going to be 6 months with COVID. We don't have anything concrete to tell you that any one of these is definitely going to work. That is still not yet come. We have certain suggestions that it may work. This thing will do good. So don't worry about it. When it comes to that, we will think, the doctors will think which is best suited for you. Don't worry about the guidelines of what you have to take as a prophylaxis for COVID not getting. Well, ICMR has definitely formulated certain guidelines. It is purely for healthcare workers. So you don't come into that. Don't worry about taking hydroxychloroquine so that COVID will not come to me. Definitely not. It is not recommended at all. One word about decontamination, which would be useful for you. Decontamination, as far as possible, if it is a school or if it is your home, it is the 1% sodium hypochlorite solution. Now, don't get worried about what this 1% sodium hypochlorite solution is. It's nothing but it is there in all your floor cleaners. You have those Lysols and so many branded things which is there in your market there. Everything has that. It is more than enough to clean surfaces. But high-touch surfaces, what I mean by high-touch surfaces are the doorknobs, telephones, you have the mobile phones, staircases, you have this lifts, toilets, taps. So all these should be frequently, especially in a school, there should be somebody who would frequently clean it with 70% alcohol. Just clean, wipe it off, more than enough. Every 3 to 4 hours, it has to be done. Low touch surfaces are like mirrors, surface of the wall. They need to be just mopped up with 1% sodium hypochlorite solution. Now, sodium hypochlorite solution is available in different floor cleaners, which you have. Almost everything is having it. Now, if you don't have it, a simple bleaching powder is enough. Simple bleaching powder, if you can put 7 grams to 1 liter, it's more than enough. It gives you an adequate, because the chlorine into it, that gives an adequate 1% hypochlorite solution to do all those disinfection in your home and around, or in an institution, in a school. That's the fancy. Everybody is waiting for it. Everybody is thinking that the vaccination has come and now tomorrow I will be immunized for COVID. The truth is what? Do we have one? No. Till today, we don't have a vaccination as of now. But we have many companies. There are so many people running around it, so many research bodies who are doing good job. Definitely, they are all now well ahead to find an adequate vaccination. But do we have it now? No. Is it under trial? Definitely, yes. There are many vaccines under trial, and one in India also definitely is under trial, which has been in Pune. There's one Oxford, which most of you have known about it. There's some couple of companies in USA doing it. Can we get it now? No. The earliest you can get is probably by the end of this year. That is, normally for a vaccine to be developed, it takes something from 1 year to 3 years, because there are so many trials to be done, safety issues, side effect trials. So that is the shortest possible time you can have a vaccine done. Now, the earliest we can expect a vaccination for COVID is maybe by the end of the year. How effective it is, we don't know. Now, vaccination is something where we think we immunize the person and he doesn't contact the infection. Regarding COVID, we have different strains. As of now, there are 10, sometimes some people say even there are 11. We manufacture vaccination for probably one strain. We don't know whether there is a cross reactivity, where the one strain vaccination would be effective for the other strain. We don't know whether this vaccination will last for what is the duration. For example, for chickenpox, you take a vaccination, they say, okay, fine, you get the shots, you're done, forget about it. Now for an influenza vaccination, they say you have to take it every year. So for a vaccination for COVID, we don't know what is the duration of effectiveness of this vaccine. So that is also time will tell us. So don't have that, oh, my vaccination is going to come and everything is fine for me. No. And what would be the cost in India? Approximately $1,000 for each shot. I don't know what will be in Kuwait, but these are all approximate figures considering that the current scenario, we may get it as early as maybe December and approximately 1,000. Now, if we go to another extent of vaccination, we have 130 crore people in India. Imagine that you're going to vaccinate all these 130 crore. Can you imagine how many days it will take? It will take a year, more than 2 years. At the rate of production, if you are vaccinating 1 million people per day, imagine 130 crore people to be vaccinated. It's not an easy task. So don't have that hype that vaccination is going to come and I will be fine with vaccination. So till date, the best thing is save yourselves. Keep yourself safe. That's the message which because you all have this knowledge that every day you read about vaccinations, every day you read about new drugs coming up, effectiveness of it, and it's blown up in media to the extent that every morning you read, wow, somebody has found a cure for COVID. That's not the truth. So with that, I end my talk and thank you very much for this patient listening. My message was to convey to you that the best thing you need is 3 things. SMS. S stands for social distancing. M for mask. S for soap. SMS. This is the best prevention for COVID. So remember SMS in your head. You will never forget it. Social distancing, mask and soap. Soap is for washing your hands. I hope I would be only happy to answer all your doubts, and one of you can help me out with all those queries, and I will try to do some justice for that. So I give, okay, Dr. Pratap or Dr. Jessica probably will be taking over.
Yeah. Thank you, sir, for the valuable information and guidelines. With COVID-19, I believe it's God's way of telling us that only humans can save humans through humanity. The platform is now open for the interactive session with Dr. Murali. You can post your queries in the chat box through Zoom platform or through live chat in YouTube. The questions will be conveyed to the resource person by Mr. George Swami in Zoom and by Mrs. Deepa Biju from the YouTube live chat.
Before we get into the questions, I would humbly ask for an apology because I told Dr. Binu, you already posted that you come live on Zoom, and being a patriotic Indian, this is my last Zoom program, and well, very frankly, that's a decision which, on my personal way, I have taken that no more of Chinese products and Chinese softwares. So this is the last program because he has committed it. I couldn't refuse it, and all future programs has been cancelled from Zoom and to another platform. of any choice. I am not worried about which platform it is, but it should not be a platform coming from China. So that apology, and please bear with me. I'm really sorry for that. Yeah, please, for the questions.
Yes. Parents can please post your queries in the chat box or live chat in the YouTube.
Mr. Swami, please read the questions so the doctors can answer.
Sir, shall I read it?
Yeah, please do. Please do. Somebody can read it, but it'll be easy for me, because if I go to the chat box, it'll take a lot of time for me.
Yes, sir, I'm doing it.
Yeah,
So
Dr. is online and I can see him there. Hi.
okay. There's a question. The question is it common to have irritation and pain in throat?
Okay. Okay. I told you about the symptomatology of COVID. One, you have to have fever. Nobody escapes from fever. Second thing is the sore throat. You have sore throat, and at least 80 to 82% of them do have a sore throat. Because of the sore throat, because of the irritation, you have a cough, and usually it is dry. So these are the few hallmarks. Normally, if you have a flu, it's not dry. You have either a running nose or you have a cough which is bringing out phlegm. So one who has a fever with a sore throat and a dry cough, definitely you have to be screened for COVID.
Yeah, there is another question. What foods are good during these period to have more self-immunity?
Thanks for asking it quite early. I was expecting this, and well, now, if somebody had some food which gives you immortality, everybody will rush for it. Tomorrow, if I put it in social media that if you take avocado, you're going to live for 20 years extra, and a convincing post to show that a person who is taking avocado for 20 years is living for an extra 20 years, everybody will rush to buy avocado. Now, the fact is no. A simple fact is no. You have everything in social media. There are different sorts of fruits, exotic fruits, turmeric, many things which they think are immunity boosters. I would always suggest take your proper food, balanced food, adequate hydration. Not run for kiwi, for avocados, or whatever you think is going to boost your immunity. Well, the fact is absolutely no. In that case, anybody who is sick will gobble up all these fruits, will never fall sick, and doctors like me will be jobless. So please don't get carried away by all those social media hypes about particular food. I'm not citing one particular food, because forget about food. There is hype about vitamin C, hype about vitamin D, hype about taking multivitamins. Well, anybody who is taking a proper food, balanced food, which has got adequate fresh vegetables, fruits, and good hydration, will have all this into their food. You don't need to supplement a vitamin. It's just a wrong hype that if I take vitamin, I am free of all diseases. Or rather, I am taking it for years. I was gobbling up vitamins for years now. I am not falling sick just because of the vitamins. It is just simple sense of security that the vitamins are giving you, but the vitamins are doing nothing. It is like in our places, we have securities walking around. They do nothing, but they just walk around and whistle, thinking that they are monitoring it. The fact is they don't. Robbers come and go, but the securities do their job. Just a false sense of security. That's what I'm going to tell you. So there is no hype regarding food. If you take any food, you are protected from COVID, or if you avoid any food, you will not get. Both are wrong. So my humble request is, don't entertain any of these social media hypes. Don't read it. Don't forward it. That's the worst thing you can do, forwarding such things. So I hope that is very clear that as of now, there is nothing which boosts immunity. But of course, I don't know about Ayurveda and homeopathy, because I'm not getting into it, because that's a thing where probably there will be difference of opinion. So I cannot talk about that. I'm not a person to talk about that. Regarding food, I can tell you very confidently, this is the fact.
Deepa ma'am, you can go ahead, ma'am.
Okay, sir. Good evening.
Good evening.
There is one query from the YouTube. Yeah. That is nowadays. Yeah. Thank you, sir. Good evening, doctor. There is one query in the YouTube chat box. Nowadays, we clean and wash anything that we buy from the supermarket. I would like to know if it is really required and helpful.
Okay. Now, tomorrow, if you're buying 4 kilos of Henko washing powder, you're going to wash it? It's as simple as that. You're buying a washing soap or washing powder, or you're going to wash it first and then use it. It will not be suitable for using it. Now, don't have that hype that whatever you buy from a supermarket has got COVID contaminated into it. Remember that all these are coming boxed and packaged, and then they are put into the shelf. Maybe they may have been seen or touched by some other people. And the chances of COVID spreading out of this is very, very, very remote. And remember that even if you happen to touch it, that is where we tell you, you wash your hands. You go to the supermarket, buy all these things, come and keep it in your home, then wash your hands. As simple as that. And you are not consuming the cover of anything. You're consuming what is inside the cover. I'm sure nobody is going to eat a banana without peeling it. The same thing stands true for anything which you buy in a supermarket. You are going to use the product which is inside the cover. And so don't have that fear that any product which I'm going to get in a supermarket or somebody which brings it to me or a delivery man leaves it in my doorstep, I have to wash it, desanitizes it. No, this is not a recommendation as of now. The recommendation is any delivery boy, ask him to leave it there.
So, one more query.
Please go.
Okay. Thank you, doctor. One more query. You have talked about the COVID precautions and every person should take it. If a person already affected by COVID and recovered, still he should take all these precautions. That is the next query.
Whoever has asked us a wonderful question, because once you have COVID, do I have a reinfection? The fact is you can have, and all these stands true, and all these protection stands for a person who already had COVID, not jump around that I already have COVID, now I'm free of COVID. Absolutely not. Remember that there are different strains. Now, if you have COVID with a particular strain, and whether it is alpha, beta, whatever it is, forget about the naming. If you have a COVID of one particular strain, you may not have COVID of that particular strain. And COVID, remember, it's mutating. Once it mutates, it becomes a different sort of. So the immunity which you have developed for the infection which you had will not give you immunity for all the other rest. But definitely time will tell us whether there is a cross immunity between all the COVIDs. Like if you have all the COVIDs around, all the different strains, and if you get infected by one, you are protected by others. As of now, no, because there are reinfections reported in many places. The person who is COVID negative has turned out to be COVID positive another time. So don't have the feeling that once I have COVID, I will never have another COVID. But definitely yes, it will give you some sort of immunity because it will not be as aggressive as you're getting it for the first time.
Yeah, there's another question, doctor. How safe is our lungs after the COVID attack? Because many of our friends have patches in lungs after this attack.
Okay.
That is something related to patches in the lungs.
Okay, fine. Now, this is a question which is related to a person who had a severe form of COVID, who had a lungs which is affected. Now, ones who have COVID, what is called as a SARI, that is a sudden acute respiratory illness, where you have the breathing problem, naturally, there will be some amount of damage. And usually, once they recover, over a period of time, they are back to normal. That doesn't leave a sequelae. Now, for example, if you had tuberculosis, you have a big cavity in your lungs, there are permanent damages done due to tuberculosis. But as of now, COVID, until unless is so really bad that you have survived a very bad respiratory thing, usually there is no sickness. You get back to normal with a period of time. It's not that within 2 weeks or 3 weeks, you'll be absolutely normal. It is like any viral influenza which you had and you recovered out of it. Usually it doesn't leave a sequelae. So don't have the fear that if you recovered from COVID, it always leaves a scar in your lung. God has created such a wonderful body that it can repair itself.
Yeah, another question, sir, like it's for a son of 15 years old. She's asking that sometimes he's sweating in his hand and legs. After sweating, his legs and hands become cold. Please suggest.
Okay. Anyway, this is not related to COVID anyway, whatever it is, because these are, you have people who have their palms and soles getting cold and they sweat a lot. This is nothing to do with COVID. And this is not an illness also. It is purely dependent on their body nervous system. It is not a disease of its own and it doesn't need a treatment. It's an autonomic sympathetic overdrive, which happens where you sweat in the inner palms, your soles, your feet sweats a lot. So nothing to worry about it. Until unless it's so much that it keeps dripping, then you're going to change your clothing every now and then you have to seek a help of a doctor. Otherwise, nothing to worry about it. It's not related to COVID.
Yes, thank you, doctor. Another question. Can an asthmatic carrier spread COVID?
Definitely, asthmatic carrier, definitely. Any carrier can spread COVID. Now, the good thing about asymptomatic carriers, why I told you 80% of them are asymptomatic carriers. The good thing of asymptomatic carriers, they don't have symptoms. You really need to cough out or sneeze out to spread it. It's a droplet infection. It's a respiratory infection. So naturally, asymptomatic carriers are not going to spread it to others until they really cough. And that is where we say mask. You're already wearing a mask. Even if you're symptomatic, if you're COVID positive, the mask stops nearly 90% of it. And if both people are wearing a mask, you can find that 95% of this is protected. And if you have a social distancing, around nearly 97% of it is protected with the social distancing. So don't worry if you're an asthmatic, you can spread COVID because asthmatics definitely will cough, will have breathing problem, can sneeze because of allergy. So you have a chance of spreading.
Okay, sir. Here we have a single transport in which a large number of people travel to office. How to prevent ourselves if we are sitting together till the destination? That is the next query.
Okay. Now, in Kuwait, I presume most of the public transports are AC. Now, the problem with an AC in a bus is a common one. Like as you have in a mall, you have one AC which has got a whole area which covers the mall. The same way it's in a bus. You have a one AC with the ducts everywhere, and it's through the ducts the AC cooling is there. And there are ducts which take back air also, the ventilating ducts. It is common. So the chances of spread in a bus, in a public transport is there compared to another open place. But the best thing you can do is if you're wearing a mask and if you're maintaining that distance, like if you see that only one person sits in a seat and the other person sits zigzag, that's what they do in the aeroplane. That is social distancing is there, mask is there. And don't keep holding on to the common bars in a bus, public transport. That's how you can see that it is minimized. I will never say that public transport cannot spread COVID. It can. So you take all the precautions. Go out only if it is necessary in a public transport. If you want to go to your job destination, see that you go with all the precautions, with the mask and with the social distancing, which is adaptable to that particular bus. They may have certain norms that you can sit alternate seats. So these are the few things which we are practicing here in India also. In my place, Kerala, in bus you have to do that. Nobody can stand in a bus, no overcrowding in a bus, alternate ones. That's the best you can do. Now, remember, we have to know to live with COVID. Not that since the COVID is there, everybody will stop going to work, no more work until COVID goes. How long will you do that? So we have to accept that. That's why I said in my slide starting that we have to learn to live with COVID, learn to coexist with COVID. Okay, next question, please.
Okay, so
Another
one
question.
more.
Okay, carry on.
Okay, so one more question, that is this wearing mask. Does wearing mask reduce the intake of oxygen?
Well, wearing mask doesn't reduce the intake of oxygen. But if you technically speak, wearing mask, especially the N95, you're rebreathing of the same carbon dioxide which is expelled is slightly more than normal without wearing a mask. But remember that this is not going to cause any problem, except that there will be a bit extra amount of carbon dioxide because you're rebreathing it. The whole carbon dioxide which you expelled out may not go out totally, because you know the N95 mask is so tightly, snugly fitting onto your face that you keep rebreathing some amount of air which you already expelled out. So oxygen, don't worry, you will have enough oxygen through the N95 mask. The other mask is definitely because it's got only a covering, it's got open upper part and the lower part is open. So that question doesn't arise. It's only for N95.
Yes, sir. Another question. Is it safe to take morning walk outside like parks during these times?
It is absolutely safe to walk, provided that you keep that social distancing. Now you're walking in an open park. Definitely it's an open air. It's not a closed environment. If you are keeping that distance of 2 meters, more than sufficient. So there's no fear that if I go for a morning walk, I will get COVID. I would always say that keep distancing, keep the mask, go ahead with your walking.
Yeah. Another question, sir. Does temperature of water during hand wash also have an effect?
Now, for COVID, it's not the warmth of the water. You can't fry your hands to kill COVID. I am sure that you cannot tolerate at a 60 or 70 degree temperature so that COVID is destroyed. So you use warm water, you'll burn your hands. So never ever try it. I told you why we are using soap. COVID has got a lipid coating, lipid layer cell. So whenever you use soap, this breaks. So it's not the temperature of the water which matters. It is the soap which matters. So don't have a misconception that if I wash with warm water, my hands are absolutely clean and sterile. To keep your hands sterile, you may have to do it for 100 degrees where you will burn your hand. So soap is only thing which is necessary and is only thing which is recommended. Soap and water.
Okay, sir. One more query. That is, if a person has asthma, they can get can he catch and transmit COVID fast? If he is having asthma, can he catch and transmit COVID fast?
I have answered this earlier. It's not that they are transmitting fast. Any asthmatic patients will have breathing problem. They are going to cough. They are going to sneeze. So if you don't have those masks, you are going to spread it to others. It's not that asthmatics are going to spread it like wildfire. No, definitely not. They are like any other people who has a COVID. If you cough, if you sneeze, you're going to put the droplets out in the air. So mask is the best choice, and keep yourself confined. Why do you want to go out when you have asthma? You are itself vulnerable. Your chances of getting COVID is so high when you go out with a respiratory problem. And now if you already have COVID, stay back at home. Why do you want to go? You're not supposed to get out.
Okay, one person, he's not having the taste and smell. Otherwise, health-wise, he's perfectly fine. Does he still need treatment?
He doesn't need any treatment. Just tell him that he is fine. Because I just told you that this could be one of those. That doesn't mean that everybody who has lost the sense of smell or taste has COVID. It's as good as saying that any bird who is black is a crow. So remember that, no, absolutely not. He's fine, and I'll let him sleep comfortably today.
Okay, George sir.
Yes. Someone with a pacemaker is a high risk if get affected with COVID, or is like any other who gets affected, or is the pacemaker acts as a support for him?
Anybody who has a pacemaker, I suppose you talked about pacemaker, no?
Yes, sir.
Okay. Anybody who has a pacemaker already has a pre-existing cardiac disease. So I already showed you the graph of the percentage of people who have a pre-existing cardiac disease. The chances of being in the other side is more than a common person. That is, the risk of developing complications, like out of 100 people who have cardiac diseases, 90 will be all right, 10 will not be all right. 10 of them, 10% will succumb. So remember that you are increasing your risk from 3%, you are going to 10%. So anybody who has a cardiac disease, a pacemaker also is put for a cardiac problem where heart beating is not normal. So definitely you also carry the risk.
Yeah, another question, sir. Is it safe for the kids to eat food after using alcoholic sanitizer? Any side effect is there?
Yeah, it's a good question. We definitely, now you sanitize your hands with the sanitizer. That doesn't mean that you are prepared to have your food. That is the emergency thing you do. Now you don't have soap and water wherever you go. So if at all you are going for a meal where you are going to use your hands, definitely you got to wash with soap and water. There is nothing else, no excuse. If you don't have soap and water, use anything. Use a spoon to have your food. Having it with your bare hands, you need to use the soap and water. So there is no misconception that I have cleaned my hands with alcohol. Now everything is fine, I can. The problem there is, once you clean it with alcohol, it has alcohol remnants in your hand. So that is why we always want people who think that washing my hands with alcohol, then I can go and have my food with my bare hands. No, you have to use a soap and water.
Okay, so for a diabetic person, the foods are already controlled, especially carbohydrates and all. So on this phase, how can they have a balanced food, or what type of food should they have to?
See, how did you get the notion that diabetics are not on a balanced food? That is absolutely wrong, because you have to get back to your doctor who is treating your diabetes to ask what is a balanced food for a diabetic. In short, I will tell you, diabetics is not a deprived population of starving people. Don't have that wrong feeling. Diabetics are not starving people, or not people who are not given a proper meal. They are getting a balanced diet. And what is a balanced diet? A balanced diet is not that you have to have plenty of sugar or plenty of carbohydrates. No, you can balance it with proteins, you can balance it with fats, vegetables. You have no restriction for vegetables other than that few tubers. So life doesn't end here that because you're eating less of carbohydrate, you are undernourished. No, there is a balance between how much carbohydrate you need to take, how much proteins you need to take, and how much fat you need to take. So you just get back to your doctor who is treating your diabetes, and don't carry the misconception that I am taking less carbohydrate, I am undernourished. Definitely not. The body is capable of converting anything you eat into sugar, whether it is fat, proteins. So ultimately your body fuel, the petrol of your body is glucose. Only thing is that when you take more carbohydrates, your sugars are going to peak up. So that is why we are restricting carbohydrates, and you are advised not to take simple carbohydrates. You're going to take complex carbohydrates. That itself is a bigger topic to discuss, because probably it will take a longer time to tell you and explain about what carbohydrates. So, but in general, I'll tell you that if you are taking less of carbohydrate, well and good, your diabetes will be on better control, but you are not a deprived person of nutrients.
We'll quickly have 3 more questions, sir, and we'll end up the session.
Yes, sir.
Sir,
There is another question.
Yeah.
Is there a second chance of COVID if we mingle with COVID patients?
If you have COVID, the reinfection of COVID is still there. As of now, with the data which we have, we cannot disprove that definitely once you have COVID, you will never have COVID. So I would always warn anybody who had COVID infection and you are cured out of COVID, don't move around freely thinking that I have already had COVID. Now my chances of getting COVID is not that, it is wrong. Reinfections are reported. So you also have to undergo all those social customs to prevent reinfection from COVID.
Another question, sir. So when we cough, the particles will go back to our mouth, infecting it's going to infect very seriously?
Now, if you already have COVID and if you cough, remember cough is a natural mechanism to throw out. Okay, you already have in your body enough virus that depending on your immunity, the severity of the disease will be there. It's not because that you cough and you rebreathe it because of the mask, you are getting more infection. Definitely not. You are infected, your body defense will work to see that you overcome the infection, irrespective whether you are wearing a mask or not. The mask for a person who has COVID is to protect that he doesn't transmit to others. But if you wear a mask, it is not going to make your COVID serious enough. Definitely not. That's a wrong conception.
So we can have the final question now.
Yes, ma'am.
Okay. Is there any threat in using bank card and receiving paper currency from others?
It's an often asked question. Now, bank card, definitely ATMs, now you be using it in the ATMs. So we always say, use a hand hygiene, simple hand rub after using a bank card. Now, regarding currency notes, you can't sterilize it. You can't wash it. You can't use the alcohol to do it. But see that you handle the least. Now, as of now, most of the transactions are with card. And now we have cards which are wireless. You don't need even to swipe it. You have just got to place it over there. So use all those other measures to prevent. That doesn't convey the message that each currency you handle has COVID into it. Remember that COVID is not everything. The currency has everything down the earth. It's got every virus, every bacteria onto it. Is it killing you? No. You're still using it. People are putting currency in their mouth. You can see that when they're counting, how do they count currency? You can see that they use a bit of saliva, then start counting, use once again saliva. So the chances of getting COVID out of it is so negligible, but that you protect yourself by handling it the least without a phobia and use currency when direly necessary, otherwise use your card. You can use hand wash. So I'm not conveying a message that currency is going to transmit COVID.
So we can have one or two more questions.
Yeah.
You can
Another question. As you said, there is no medicine for COVID. Then why doctors in India, they give injections and charge more for the treatment?
Oh my God. Now that's the most difficult question which I need to answer. And you have put me in a dire soup where probably I'll be thrown out of my hospital. Well, to be frankly speaking to you, there are reports of this in many places. Like all other professions, I will never say that my profession is also absolutely clean. That everybody is absolutely clean and sincere to the job. So I am not a person to talk about all those what others are doing out of commercial interest. Truly, definitely there is an element of commerce into it because everybody needs a living, right from the cleaner in a hospital to the doctor in the hospital. Frankly, they need to be paid. So each hospital has their own way of charging for a particular thing. But I know I had seen many reports in TV as well as in papers that they are overcharging, or rather exorbitant charges. Well, there are people looking after it. There are governments who are running after it. So I would definitely feel not to take these questions, but I would always say that never look into every doctor and every hospital in such a way that they are going to fleece you. These are the persons who are going to fleece you left and right. I've been in this profession for years, more than 3.5 decades. And each hospital which I worked, I have never seen them doing that. Definitely there is a humanitarian still intact. Don't have that fear that when you go to a hospital, now I'm going to a place where I'm going to be scaffolded. I'm going to be fleeced and my pocket is going to be empty. Definitely not. You can confidently walk into a hospital and feel free that you will not be taxed up for that. But of course, COVID has made things slightly expensive, which I've got to tell you, because we are using more protective gears more than what it was before. And to tell you, one gown, what is called as personal protective equipment, the one gown is costing 1,000 rupees. One gown. Forget about the mask, forget about the gloves, how much you use, forget about the face shield. There's so many other things. So there is an extra cost coming in treating COVID patients. It is not the medicines. Whenever the patients get into complications, get into ventilators, things are costly. A day in ventilator is extremely expensive. Now, can everybody afford to get into ventilators? No, definitely not. So it all depends on the means also and what complications you have. Otherwise, a simple COVID patient, I would tell you, stay at home, don't go to a hospital. That's the best advice I can tell you. Even if you're COVID positive, if you don't have symptoms, stay back in the place which is designated to you as quarantine.
So thank you, sir. I think most of the questions are the same, repeating what we asked. So from my side, I think that's a last question.
Yeah. Anybody else who want to ask? Deepa ma'am, anything else?
No, doctor, it's fine. Almost all the questions we have asked. Thank you. Thank you, doctor.
Thank you very much. Pleasure. I mean, interacting with you, and definitely, Dr. Binu Mohan, I still remember 6 years back when I came to your school. It was a great experience, probably an eye opener for me. How the future of India, the young students, they're really good, and what they need is pure motivation from your side. And I can see the change in community school. Don't feel bad about any other schools also, but because I was closely interacting with community school, I had seen the change, and till today also, I know the changes because Dr. Binu Mohan every day communicates through his social media on what he's done. I'm so happy that you've got a wonderful principal. And thank you very much for listening to me patiently.